You may not be loving summer if you get sunburned or, worse yet, skin cancer.
There are different types of skin cancer.
Dr. Razi Sultani is a Cleveland Clinic dermatologist.
The most common type of skin cancer is basal cell carcinoma. About 20%, so 1 in every 5 Americans will get basal cell at some point in their lifetime. Basal cell cancer usually looks like a pimple that is new, grows quicker than a regular pimple, and doesn't go away within a few weeks. Sometimes it gets ulcerated, meaning you'll see a little bit of blood or crust on top of that. The other common type of skin cancer is a squamous cell cancer, which a lot of times looks like a red scaly patch. Melanoma is the least common type of skin cancer, but the deadly type.
Doctors recommend knowing your A, B, C, D, and E's for melanoma detection. A is for asymmetry.
If you draw a line, one side doesn't match the other side. In regular mole, it's symmetric. Melanoma is not symmetric.
B is for border irregularity.
If you look at borders of a mole and it's perfectly sharp, it's probably a benign mole. Melanoma has jagged or notched borders.
C is for color variation.
Melanomas usually have different shades of color. They can be blue, gray, dark brown, light brown.
D is for diameter.
Most melanomas are more than 6 millimeters in diameter. So what's 6 millimeter? About the size of a pencil eraser. Again, there are some melanomas that are smaller than that, so it's not that anything that's smaller than that is definitely benign, but that's one of the things that, we look for.
And E is most important, evolving.
If you have a mole on your skin that is rapidly changing, meaning changing in color, changing in size or shape, that's another sign that it probably needs to be looked at.
Our best course of prevention is using sunscreen. Look for SPF 30 or above. Broad spectrum, meaning it blocks harmful UVA and UVB sunlight, and water resistant. Reapply every 90 minutes to 2 hours.
If you're out swimming, after toweling off your skin, you need to reapply it. If you're exercising and you're sweating a lot, once you're done exercising, you want to reapply it. One of the most common mistakes that people make is that they don't put enough sunscreen. To cover the entire body, we need about 1 ounce or a shot glass of sunscreen. We need about a nickel size to cover the face, about a teaspoon to cover the back, another teaspoon to cover chest and abdomen, another teaspoon to cover each leg, and like half a teaspoon for each extremity. A lot of sunscreen bottles are, 5 ounces or so, so imagine you would go through 1 bottle of sunscreen in 5 days, and most of us don't really do that. Most sunscreens per the FDA have a shelf life of about 3 years.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.